Awesome. Thank you so much. I'm Drew Woods. I'm one of our PGY4s and chief residents. Dr. Coyne is here on the call as well. He's my co-chief and one of our PGY3s. And then Dr. Yakanti is joining as we speak, and she's one of our PGY3s, and she's our recruitment chair this year. So we're really excited to be with you all today. Really appreciate Pathways for picking this up because it was a great resource for all of us.
Drew,
Um,
sorry to interrupt, but you're on presenter view
Dang it.
on the shared screen.
How about now?
Looks great.
Okay. All right. So a couple things about us. We're a four-year categorical program now that started this year. So we just welcomed our first class of interns, which we're super excited about. We take four residents a year. We have a pretty diverse fellowship match. We've matched into a whole host of things over the last 10 years or so. I'd say probably a 50-50 split at this point in terms of current residents of what we're planning on doing, and you'll see that in the coming slides. I think the biggest selling point of our program is our hospital. It's one of those like you really can't appreciate it until you're there in person. So Fraser Rehab is an attached IRF, which is licensed for up to 115 patients. Currently, based on nursing staffing, we're staffed for about 95. Of those, we see 500 plus strokes a year, 350 plus brain injuries, 200 plus spinal cord injuries. You'll see everything from acquired brain injuries from cancers to traumatic brain injuries to non-traumatic and traumatic spinal cords. You will see literally everything. We take vented spinal cords. We have an emerge program for disorders of consciousness. We have a pediatric department, so we have inpatient peds. So I'm convinced that by the time you finish here, you are ready to take care of any type of patient in any setting. One of the things that I didn't appreciate until I got to Fraser was, questions that I wish I had asked on the interview trail. And the type of hospital and who runs your hospital is really important. And so I urge you all to ask those questions when you're interviewing. And what I mean by that is, are you freestanding or are you attached? So a freestanding hospital means that your services may be a little bit more limited than what we would have at an attached center. So every single consultant under the sun that works at U of L has access to Fraser, meaning if we get out of our depths and we have a transplant patient and we need a transplant to come over, they're right across the pedway. In addition, who owns you? So U of L owns us. We're not owned by a for-profit, which means that the patients that we take, much like Schwab just mentioned, are at-risk populations that oftentimes are getting declined from some of those for-profit institutions. So we're getting difficult placements. We're getting every, Medicaid, we get homeless populations, we get, at-risk youth, we get everything that you can imagine at Fraser. And in addition to that, we get every procedure you could imagine. We blow all of our peripheral joints and Botox injections and axial injections out of the water. And we'll talk about where you get some of those done at. So these are some of our training locations. For those of you that'll be joining us, you'll actually be at the new VA when you rotate through the VA. We do 2 months a year at the VA. The new hospital is scheduled to be done hopefully next summer, but more likely next winter. Fraser's up top in the middle. It's a giant 15-story building that towers over all of Louisville, and I'll show you a view outside of it not too long in a little bit. Norton Children's is attached to Fraser. So that's our children's hospital. There's a pedway that connects us, so we get a great pediatric exposure. The bottom middle there is a joint venture between U of L and LifePoint Health. So that is a community hospital that we do a 1 month rotation at to give you a flavor of what it's like to work for a for-profit institution. And then lastly is the bottom right, which is University Hospital. That's an old picture because it's undergoing a multi-million dollar facelift right now and should be done here in the next hopefully 6 months or so. But a lot of growth at U of L right now, which is really exciting. These are our new PGY1s. We matched two U of L students for the first time in a long time, but otherwise you'll see we have a really diverse placement in terms of our who we bring, but also where we bring them from. So really super excited. They're going through the intern year process now and kind of being our test dummies. And so by the time that you guys get here 2 years from now, we'll have the machine cooking and really flowing smoothly. But they're getting great exposure and they're learning the system ahead of time, which we're really excited for. Dr. Coyne did his med prelim year at U of L. So if you guys have any questions regarding kind of what the intern year looks like, he went through it before he was an official U of L PM&R intern, and can provide a lot of great insight there. Dr. Iaconti and I actually did our TY years at the same place, just a year apart, so we can kind of give you some insight into that as well. And feel free to put questions in the chat, and Dr. Coyne and Dr. Iaconti can respond as I keep on going. But these are PGY2s that are getting their feet wet now, and I wish I could say it's a sink or swim, but they're all swimming really magnificently right now, and we're really excited to have them on board. As you can see, all of them have various pursuits that they're interested in. Our program coordinator, Patty, said that she hates when we put future plans in here because as a PGY2, you never know what you want to do. So she stresses that nobody's expected to know what they want to do when they come here. But these are just some of the general interests. I came in thinking I was going to do spinal cord, and I've actually decided to do general inpatient and some consults. So you can certainly change along the way. These are our PGY3s, Dr. Conti and Coyne, who are here, Dr. Gazy and Diala as well, and then our PGY4s, who are counting down the days to graduation. Excitedly, I will actually be staying on as faculty. I've already signed my contract, so those of you who are being recruited for this cycle will be my second class that I would have. So I'm very excited to meet you all on the interview trail, on the recruitment trail. And I loved it. I'm not from Louisville originally. I'm from New Jersey. Dr. Iaconti is as well. And I think she's hoping to stay in Louisville as well. So we've both loved the city so much that we're hoping to stay. And Dr. Coyne's from West Virginia, and I've been whispering in his ear, and I think he's very interested as well. So people that come here typically love to stay here. Program leadership. So Dr. Kaylin, Dr. Naramale is our new APD. This is her first full recruitment cycle. She started in December of this past year being our new APD. We have two program coordinators. So Christy Green helps with the student side of things. So when you are, communicating, trying to set up rotations or trying to reach out to the program, you're typically getting in touch with Christy first. And then Patty, who refused to have her picture put in here, but she's the MVP. She is our program coordinator for all the residents. So she's the one that we're going to on a regular basis to try and help us achieve our goals and dreams. So she is the MVP, as every program coordinator is. So this is where we're from. You can see we're spread out. This is going back, I think, 10 or 15 years of alumni. We've taken multiple residents from Canada. We've taken multiple residents from really all over the country. And we have multiple faculty members from other countries as well. So our faculty, our residents represent diversity, not just in how they look, but also where they're from and the experiences that they bring along with them to Louisville. So we have a really rigorous academic program. I highlighted or I underlined and bolded the things that I think are unique to our program. ACGME requirements, you're going to have a standard amount of spinal cord, a standard amount of, inpatient and outpatient exposures, but not everywhere has some of the experiences that we have. So first and foremost, you get an elective in every single year that you're here. In your PGY 4 year, you get two electives. So we really enjoy the fact that you get to explore your career interests early and often. In addition, you get an entire month of cancer rehab, which I think is unique and I haven't seen everywhere. And you get 2 months of peds rehab. Dr. Iaconti is on peds right now, so if anyone is interested in peds, I highly suggest putting some comments in the chat to her because our exposure varies from on a day-to-day basis from rounding on our inpatients at Frazier to then going across the pedway and doing consults over at Norton Children's to then going to clinic and doing Botox. I think today Dr. Iaconti did all three of those in one day, which is why she looks like she's tired because it was a busy day, but really just great exposures. And then like I had mentioned before, the community inpatient rotation, I think, is really unique because you get to see both the academic setting of what it's like to work in an academic medical center for rehab specifically, but then also what that looks like in a community setting where you might have some more limitations like not being able to take all the Medicaid patients or being restricted in terms of how long patients can stay. At Frazier, we operate under some of those limitations, but we also are a little bit more open in terms of the patients that we're able to take. In addition, we have just general lectures, but then also some resident-led lectures like journal clubs. We do a senior series, monthly M&Ms, and we also have a financial series to try and combine medicine and money. We have attending-led lectures that range from, your bread and butter, stroke lectures to specialty lectures on MS and disorders of consciousness and movement disorders. And then we also have discipline-led lectures. So we're in technically the Department of Neurosurgery. So we have lectures with the neurosurgeons at times. We get lectured by pharmacists and our nursing and therapy staffs to make sure that we are getting the breadth of what you'll experience in rehab. And then in addition to that, the typical board prep that everyone typically gets, we do take the EMG SAE. So you get the regular AA PM&R one, you get the EMG one, and then we do mock oral boards as well, hosted by our faculty members. Um, in addition, I think money matters. So if you factor in the cost of living, so Bankrate, I highly suggest you all use it during your recruitment cycle and compare salaries to what it's like to live in different places. So this is based on a PGY2 salary. So according to Bankrate, based on the PGY2 salary of $66,000 in Louisville, you'd need to be making close to $160,000 to live in the same standards in New York City. So I don't think most New York City programs are paying $160,000. And so that's just to show that your money goes further in Louisville. And I think that's why so many people enjoy moving down here. Like I said, I'm from New Jersey originally. My wife has only ever lived in New Jersey, and we moved to Louisville and never plan to go back. It's really nice to be able to afford to live nicely where you're at. In addition, moonlighting is allowed. So some of our residents do Botox on the sides. I currently work in an urgent care doing occupational medicine. Some of our past residents have done disability exams as well. So there's the ability to moonlight as early as your PGY3 year. Like I said before, mock oral boards. All PGY2s have their own personal cubicles. So you can set up, and even as a PGY3 and 4, you kind of share a cubicle with someone just because you're not on inpatient quite as much. We get free parking. There's a physician garage that's right across the street from where Fraser is, so it's just a short 2-minute walk from the garage into Fraser, which is really nice. You never have to worry about finding a spot. You get access to the AA PM&R Q Bank for free, as well as the Kessler Board Review course for PGY4s, again, completely free by the program. And you get an $1,800 educational stipend. This will be news to Killian and Shruti, but Patty told me today that the goal is to increase that. She just didn't want to announce it to the residents yet until it's finalized, but it's under the budget is being approved hopefully this week, and so we'll get a little boost to our educational stipend, hopefully pushing it as high as $2,200. So it'll be really nice. And this is the view. This is like my favorite part of Frasier. The top right, that was my cubicle as a PGY2. The view, though, out this window is incredible. It really does make you feel like you're on top of Louisville looking down on the city, and like you're not claustrophobic at all because there's tons of windows everywhere. So this is where you get to write your notes on a daily basis. So you can't beat it. Okay, so our leave policy is very generous. You get 20 PTO days per academic year. In addition to that, you get 5 conference days. So those conference days can be used at AAPM&R, AAP, or any other conference that you're presenting at. And I'll say that's a loose 5 days as well. So for example, I'm going to the AAP NXT conference in Chicago in August, and Dr. Kalen is allowing me to use my conference days, 2 of my conference days for that, which doesn't fit into this box. So if it demonstrates, scholarly activity, it's usually approved. Um, in addition, we get a quarterly half wellness day. You don't have to ask for it. It's just given to you. So if you wake up one morning and you're like, I just need a morning to myself. You can take a half day. A lot of us will use that for dentist appointments or to take our kids to the doctors. But those half day wellness days don't count towards your PTO, which really allows us to get, personal things done that we otherwise wouldn't have time for. And we also have maternity and paternity leave, which is an ACGME requirement, but ours is 100% paid for all 6 weeks, which was a big push by our house staff and our prior PD, Dr. Schuster, who really helped us achieve that. We don't have a union at U of L, but our house staff is as close as you can get to one. And our house staff talks with our hospital leadership on a regular basis to, try and increase the benefits to residents. Our call schedule, we recently revamped it again this year. So we now are on call 1 day a week during the week. I'm actually on call right now, and I've only gotten text messages from my wife so far. So that is a good night so far. And then we round on Saturdays and Sundays. So if you're the weekend resident, you'll round on Saturday and Sunday with the attending. We have progressive responsibilities. We take home call, which is really nice. I'm sitting in my office right now.
Dr.
Uh,
Woods, you have about 5 minutes left.
Thank you. So progressive responsibilities, PGY2s will take more call, but they don't take any call in July, so you can get your feet wet and get settled in. And then PGY3s take 30 to 33 days, and then PGY4s take 20. And we try to balance the weekends specifically because those are typically the harder calls, and we don't want the PGY2s to have all of the weekends. So we try and create some balance there. There's access to a physician's lounge, which has free breakfast and lunch. Breakfast is not hot. It used to be before COVID, and they've always talked about bringing it back. So maybe by the time you guys get here, it's back. But it is a hot lunch that's free. We get catered meals with all of our town hall meetings every month. There's a Chick-fil-A, Starbucks, Panera. There's food trucks, which is my favorite thing. I had them today, and that's why I'm sleepy now. But those are all outside of our building. You also get access to the exercise facility and the YMCA with discounts. And again, just like can't beat the views. And God, the food trucks are so good. They're so, so good. Not for your wallet, but for your belly. Our work schedule, pretty loose. We are rarely going over 50 hours. I'd say the inpatient rotations are the only time you're kind of coming close or going slightly over, or if you're on call for the weekend. But other than that, it's pretty loose and easy. Tons of faculty support. We have a huge culture of peer support. We have a program where it doesn't matter what stage of life you're in, whether you come here and you're single, you're in a new marriage, you just had kids, you're like me and have 3 kids. We are welcoming to all of those, and everyone can kind of feel supported along the way. Um, and we do resident-driven initiatives. If you come here with a good idea, we will make sure that it happens. So Cardinal Conversations, which I'll talk about, it was my idea as a PGY2. Shruthi's going to be spearheading it this year. And so that is, that was my initiative that I just came in and said, hey, I want to do this. The changes to our call schedule were driven by residents, and Dr. Coyne has enacted a really rigorous ultrasound curriculum lumped into our didactics for this year, and that was his passion. So if you have a passion, you can come here and make it happen. And there's tons of support. 20 minutes is never enough time to talk about our program because I really love it. I'm from Jersey, so I talk fast and I drive fast. So if you felt like I covered anything too quickly, this is the Cardinal Conversations, which I talked about. It's a 30-minute Zoom call that we have on these 3 dates. Once I'm done running my mouth, I'll put the link in the chat for you guys to sign up. Our
Two
first
minutes.
one is actually next Wednesday. Thank you. Next Wednesday, and we'll talk about, kind of a little bit of what we talked about tonight, but then more about our faculty and kind of what your experiences would look like. And then August 6th and August 27th, you'll hear more from us. A couple of notes about our and I'll put this up so you can write down email addresses. Our interviews are in person. We're one of the few we were the only program last year that did it, and hopefully one of the few programs that do it this year. It's an incredible experience. You come here, we take you out to dinner the night before, and you get to hang out with all the residents, and then you'll interview with myself or Killian, as well as 4 of our faculty members. During your time here, you'll go on a tour of Fraser. You'll get a swag bag. We really try to treat you guys right for traveling into town. But we feel like Fraser is the type of place that you have to see it to believe it. And once you see it, you won't want to leave. So we're really excited to have you guys in Louisville. We are participating in the SLOs. We're recommending that everyone has one. It's not required, but we would appreciate to have one. I had seen a question before about a pediatric SLO versus an adult SLO. I think peds, alternative experiences are an awesome option for you. So I highly recommend whatever slow you can get, you can use. A peds slow would be great. Our Dr. Barton and Dr. Schuster, our peds attendings, would love to read it. But if you have any questions, these are the email addresses, and we'll be hanging out in the chat for a little while as well. And I'll post the link up there for you guys to sign up to Cardinal Conversations, and we hope to see you there.
Thank you guys so much. And you are right on time with 10 seconds left. So great job.